Questions?
My name is Chris Shanley and I am a clinical nurse practitioner at Arnold Lodge. So I started at Arnold Lodge in 2007 as a healthcare support worker on Pennine Ward, which at the time was the male acute admissions ward. Previous to that, I'd worked in PQ, I'd worked in orphan wards, I'd worked in functional elderly, I'd bounced around a bit within nursing, and immediately I knew that I was going to be in forensics for a while. The safety was completely different to what I'd known before. The support, the teamwork, everything about it was excellent. And that was over 15 years ago, and my opinion hasn't changed now. So I worked as a HCA and then as a senior HCA for 5-6 years. And then I eventually went back to university and I did a 2-year Masters of Mental Health Nursing. I came back to Arnold Lodge as a Band 5 nurse, then latterly a Band 6 clinical team leader. And then about 18 months ago, I started working as a nurse practitioner for the male mental health service. So what I do currently is a new job. It's an interesting job, it's different. There's a lot of freedom in it and autonomy that in previous roles in nursing didn't really exist. You know, my work is split between 60% clinical work, where I work with patients, but I also work to support clinical staff around their training, education, support, helping them deal with difficult times, doing clinical supervision, formative supervision, and then 40% of my time is in service development. So I write training, I work on projects to improve the quality of the clinical care that we're giving. So I'm in a kind of unique position in that I get to still do all of the good, rewarding patient stuff and see patients' journey and progression. And also I get to do all of the work with the staff nurses and the CTLs in their progression, seeing them come on. I have probably been to 10 students who came and worked here. Some of them are CTLs now, one of them is a ward manager now. You know, personally that's something that I find quite rewarding. So it's not just the work with the patients, but it's also the work with your colleagues and supporting them and building them up. And in my role now I get to do both of those things. So that's quite fulfilling. Pause briefly, what else shall I talk about?
I think you've just covered loads there.
Yeah, you have?
You've covered loads.
Is there any other targets, any other things we want to hear?
No,
You've talked within it about what you enjoy, what's challenging, what's rewarding.
Bullshit is my thing, isn't it?
need gap filling, speak to Kate.
Yeah.
No, I think you've gone through that. You've gone through your development. You're helping students. New starters.
I could talk more about the clinical stuff that I learned. So I taught like DVT, didn't I? And I did acid treatment, and so for me, there's been a number of opportunities that kind of Arnold Lodge and the management of Arnold Lodge have supported me to develop personally and develop my skills. I have done more training courses than I can remember around, you know, DBT informed practice, CBT informed, lots and lots of recovery work, coaching. I have been part of teams that have delivered therapeutic interventions, problem solving, arson treatment, DBT. For someone who's motivated and wants to achieve and wants to do more, Arnold Lodge has incredible opportunities. You know, you will be supported if you just want to come in every day and do your job, but if you want to progress and you want to achieve, this is the place to do that.
I love that.
Yeah? Alright.
That last, just the last question about if you were...
What would I say to somebody?
Yeah, what would you say?
Alright, hold on, let me just have a quick think. Because I don't want to cover all the ground that I just said.
Yeah. Well, you might do, because you did talk a bit about some of that as well. So.
Yeah. So, what would I say to somebody who wants to come work here? I'd say that working here with some of the most difficult, most complex, and most kind of deprived and looked down on people within society is a privilege. And being able to support people who have had terrible experiences of life, terrible experiences of services. You know, I found it really difficult in school. I've been in and out of prison. Have had no support throughout the life. Is quite a privileged position to be able to have that sort of influence in someone's life, and there is no one who can come and work here who doesn't find that sort of thing rewarding. That's kind of the essence of what nursing and healthcare work is. And if you want the opportunity to be supported, to be able to make a real difference on an individual level with people who have never had help before, this is a good place to be able to do that.